Hi guys, so it looks like as we're moving towards stages 2 and 3 of the lockdown, we're going to be coming out of quarantine soon. I know you're so excited to get back into the clinic and I cannot wait to see my patients. I have missed you guys so much. I know a lot of you are feeling quite anxious and quite stressed because it's been so long since you got to see your regular cosmetic doctors. However, it's so important for us to understand the repercussions if we don't follow best practice and the risk assessments that your provider has given to you, just to maintain the safety of the patients as well as the providers in this post-COVID era. So for the patients of Medi-Spa Cheshire, Liverpool, London, I want to assure you that we have not been sat around. We have spent the last 6 to 8 weeks ensuring that the most rigorous and the strictest guidelines are adhered to. We have been making so many enhancements and so many changes to the practices of the clinic and of the staff that you're really not going to recognize the practice you come back to. As we're veering towards the end of quarantine, the British Association of Cosmetic Doctors have released some really important information, and it's advised doctors that they can start opening up their clinics in a very slow and organised fashion, just to accommodate people who are particularly vulnerable in this difficult time. Currently the clinic is closed. However, I'm going to give you a little tour on what to expect when we do reopen. Come through. As you notice, the clinic is going to start looking a little bit different. Firstly, when patients come through, they're going to be greeted by a receptionist, and we're going to have these screens. The screens are to protect the patient as well as the clinical staff. This is one of our receptionists, Danielle, and as you can see, Danielle is wearing full PPE cover. As you will also see, patients are divided by a 2-metre distance. This means that we are always trying to ensure, where possible, the minimum safety distance as recommended by the government. We have incorporated sanitisers at multiple points throughout the clinic. We're going to be using thermal imaging cameras to detect any changes in body temperature. We operate a paperless system. This means that your private confidential medical data is stored within an iPad system and there's no circulating free paper. However, at this time, where viruses, as we're aware, can be picked up on metal surfaces or glass surfaces and transferred between patients, we're ensuring that all of our staff are thoroughly disinfecting all iPads before they're handed to you. The coronavirus screening consists of a form which ensures that you have got no coronavirus symptoms. After she's completed her coronavirus screening form, the patient will then be allowed into the second holding area. This area is only for patients who have been assessed to be suitable for treatment or a consultation. Here, a therapist or a doctor or nurse will attend to you and will take you directly into your treatment room.